Thank you all for joining us on a weekday evening. It gives me a lot of strength and a lot of cheer that I see so many people having joined me this weekday evening. As we gather here today, we commemorate National Doctors' Day, celebrating the selfless service of our medical professionals. While it's essential to honor today's doctors, we thought, why not reflect on the physicians of earlier generations? The concept of vintage salute emerged from this desire. Baswangudi, one of the Bangalore's oldest neighborhoods, holds a very rich heritage. Growing up here, I knew that countless captivating stories are awaiting to be retold. Despite the short preparation time, which was less than a month, we've put together this initiative, Vintage Salute. Although we may have missed some legends, which we definitely have missed, I know we have missed, it was very difficult to trace many of them. This marks just the beginning. Throughout this exhibition, we hope to uncover more information to enrich our understanding of Baswangudi and its heritage. I extend our heartfelt gratitude to the families who generously shared their stories and the photographs. This experience has been both humbling and inspiring for me, my team from Maya Films, and my friend Radha Rao, who's here with us today, who helped me in curating this exhibition. I invite our chief guest, Dr. Vivek Jawali, Chairman of Cardiac Sciences at Fortis Hospitals, to please come up to the stage, please. Along with him, I invite the families of the legends, Dr. PRAVEEN MURTHY, Dr. PADMINI ISSAC, Dr. DR.DEVIKA GUNASHEELA, Dr. Ramdas Acharya, Dr. Aditya Subramaniam, Dr. Saras Chandra Singh, and Dr. Indira Reddy. What a galaxy of legacy that we have on stage today, and I think it's going to be one of the most enthralling debates and discussions that we're going to be having. I would like to invite anybody from the Ramaswamy family if they would like to come in. Dr. Madhusudan, I think we asked you. You didn't want to come in? Okay. Thank you all for gracing the stage and accepting. Sanjay GURAJ, where are you, Dr. Sanjay GURAJ? One more chair. Innon chair ಬೇಕು. It is truly a galaxy that you see on the stage here today, and connecting the past with the present, none other than Dr. Vivek Jawali, because he is an old-time resident of Baswangudi and also started his practice from Baswangudi, lived in NR Colony, and I thought he would be the right person to connect all the dots together that we have on the stage here today. Just to begin the note and the context, I'd like Dr. Jawali to address the gathering and set the event in context.
Good evening, and thank you for this kind invitation and the introduction. Legacy is ever important today than ever before. Young generations, today's generation, require role model. And if we forget the past, or we are cynical towards it, we kill the opportunity for the youngsters to grow with the role model, in the shadows of the role model. Every hospital that I go in US and the Western world, most of the city halls in small communities, I always see in the corridors the photos of the old medical doyens of that area, and especially hospitals. I have not seen that in our surroundings, and so chronicling history, and especially for a community, is very important. The history of Baswangudi itself is so interesting. I don't know how many youngsters of today know how this settlement really grew up in Bangalore after the Great Plague of Bangalore, and what happened and who were the doyens. Going through this exhibition, watching the life history of all these doyens, such a bandwidth which is unthinkable. And that era, doing that work was so difficult. It needed a lot of resilience, persistence. And so this was a really goosebump experience. I hope that it comes out as a booklet, goes on the internet as a soft copy with a voiceover. And I think then that will remain a permanent legacy for people to go back, see, be inspired. But keeping legacy alive is very important. I'm neither from the past, but I had heard of all these people when I started staying at Model House in Baswangudi in the 80s, and nor I am from the present. So I am from the early 80s. I came to Bangalore in 1984. My mission was to create Jayadeva Institute. The person who dragged me here was Ramkrishna Hegde. We worked very hard for 2 decades. I hardly slept at my own home. But we trained people. We created a kind of attitude of work which was unknown in the government sector. And at that time, I had a lot to do with many people who were still alive. And their bandwidth was very inspiring. So to summarize, I think I'm very inspired by what is done today, and I hope this becomes in some form a permanent fixature. And thank you very much for this work. And congratulations to all of you that this has come here. And I think everybody should help and bring it into a permanence.
So just to introduce the guests, I'll go from the farthest there, Dr. Sanjay Gururaj Rao, who is the 3rd generation doctor looking after Shanti Clinic and Nursing Home. Am I right? Yes. Sanjay Gururaj Rao. Next to him is Dr. Sharat Chandra Singh of Sham Singh Nursing Home, a legendary nursing home still in existence from the same location in Baswangudi, Vaidya Sham Singh Memorial Nursing Home as it is called today. Dr. Ramdas Acharya is the second among the 3 generations of homeopaths who was running Acharya Homeo Clinic in Baswangudi, DVG Road. Dr. Devika Gunasheela, of course, needs no introduction, daughter of Dr. Sulochana Gunasheela. Dr. Padmini ISSAC, the great-grand daughter-in-law of Dr. Mary Ratnamma ISSAC. And Dr. Vivek Javali, Dr. Praveen Murthy of the legendary Prabha Eye Clinic. Next to him is Dr. Aditya Balasubramaniam of the Manasa Psychiatric Nursing Home. Baswangudi is, I think, probably Karnataka's first private psychiatric nursing home set up in Baswangudi. And Dr. Indira Reddy, who belongs to the family of Dr. Chandrama Sagar. So just to get the fireside chat without the fire starting, so let's just roll out the questions, Doctor, in terms of what is it to carry these kind of very rich legacies forward? What does it take?
You can notice where all these people are coming from.
Yes.
It's an unthinkable lineage. Secondly, if you take example by example, let us talk about Mansa Clinic. It's unthinkable at that time of Bangalore, one could think of an inpatient psychiatric clinic. Private. Even now, in 40s, we have so many hospitals, so much of funds. We are still struggling and coming to a term with the idea that we should start a proper upmarket inpatient psychiatry hospital. But at that time, I think it needed courage and conviction, and it needed too much attention to nitty-gritties, and it has stayed on. It did not just disappear like a bubble. And I think even if you look at the empire created by Mrs. Sagar or even Padmini ISSAC's family, I knew Sanjay's father, Guraj Rao, very well, and he was so groomed by his great father, and who has kind of quite a institution by himself. So my question now is, let us start with Mansa Clinic. How do you feel about it today? And you know the history better than anybody else. And we would love to get your inputs about this past. This is unparalleled. Mansai Clinic.
Thank you, sir. I must say I agree with you. 60 years ago, my parents started Manasa because it was very difficult to admit a psychiatric patient in any of the existing general hospitals. You would have thought in 60 years that would have changed, but it hasn't changed. Those of us who work in general hospitals know that it is still very difficult. So I must say it's a big responsibility to inherit the running of such a service, trying to understand what the last 60 years has meant and where the next few years should go. The one thing I will say, of all the privileges I have in Manasa, the biggest one is I've been away in the UK for 25 years and I've come back. I still see patients that my father saw in 1965. A young epileptic patient from the age of 10, he still comes. He says, I have traveled 80 years, 80 countries in the world. He is still on the same medicines that my father started on. So Garoin and Mezatol. Now these are still the best anti-epileptics in the world. All the new anti-epileptics are good. But it's a real privilege to see someone for 60 years and he's only had 2 doctors. He doesn't even have a file. His file was in my father's head and now it's in my head. And I must say it's such a privilege, I cannot tell you. I think as a doctor, these are things that give us enormous pleasure. The building and all of those things are a big headache to me, and I'm not very good at these things. But hopefully, thanks to Vinay and Dr. Sanjay, we may have some improvement in Manasa over the next year. We'll renovate it and do all those things. But it is the human legacy and the goodwill that our parents, our forefathers have earned is an extraordinary privilege. I can't even begin to measure it.
No, this is a very important aspect of Indian healthcare. I entered 15-20 years ago the Medical Council of India. I was on the Academic Council, which is the thinking arm of MCI. And I was there on that council for 10 years. So we created a lot of new courses, new postgraduate courses, etc. But all the time I was debating that if you look at India today, modern India, more than 50% people are not normal here. And the kind of fund that need to be allocated, the kind of manpower need to be trained, both at the high, medium and low level, and the kind of penetration of those services that have to be done. It has now dawned. I think now I know that a lot of funding has been provided for, but the scope, width and breadth of the scope is enormous. And let's go back to Sanjay. Sanjay's legacy also, I think anybody who is a little old here, they know who Ram Rao was and what he meant, and then where it has come to. It's
yeah, thanks, sir. Thanks for the kind introduction about my family. Yeah, I mean, when I started coming, when I came back to India and we started practice, we were already told that your dad and granddad had a huge legacy. My grandfather had a huge practice in Chamrajpet, Ram Rao Clinic, and he was, to start with, Bada Bada Bandhu. So the first thing, the patients would come and I would sit and say, okay, my consultation is over, and they'd ask me, do you need to pay you? Do I need to pay you? Like, that your tata never took any money. So it started like that, and then it's a little odd because I would say, okay, don't pay me, till I got married and my wife said, are you mad? So that's one of the things. The other thing which I always remember, and it's incredible, my grandfather passed away around, I think 50 years ago, or 51 ago. Around 2 years ago, I had a 80-year-old gentleman who came, who heard that I was Ram Rao's grandson, and he had some health issues, and we were just chatting. And out of the blue, he pulled out a prescription of my grandfather and a certificate of my grandfather. The certificate said that he was going to go for a course or something in England, and he said, you are fit to sail to England. That's the certificate he's given. They didn't even have a plane at that time, it looked like. And it goes on endlessly. You can go on. I mean, I'm a pediatrician, so sometimes I'm forced to give injections, and when I give injections, I mean, the child is crying, and then the mother is a little upset. The grandfather is scrutinizing my technique, and then they tell me, "Nim tata kottagesh nautarlila." So I'm unable to understand whether, I mean, is he got to go to see Aditya, or I don't know. So the thing is that it's a huge burden. I'm sure everybody here will actually identify that we are actually pegged against our parents and our grandparents, and we are supposed to, be as good, if not better. And I think all of us are striving incredibly hard to be where we are, because with legacy comes a huge amount of responsibility. I think it's easy, as my father said, "Appa hakid alad mara, ನೇಣಾಕೊಂಬೋದು ಆ ಶೇಡಲ್ಲಿ ಇದಿರ್ಬೋದು ಅಂತ." My father used to say that, and I was wondering, why is he telling me this? I thought I was doing reasonably okay. But I think we come with a huge amount of responsibility, and I think we promise to be that same way. I think it's also our value systems. I'm sure all of us will actually understand. No disrespect to anybody else who's come in further, but the value systems that we were actually brought up, the value systems we saw in our parents, and generally that's what we imbibed. It was so different. It was so much to do with character, so much to do with actually providing betterment rather than the economic benefits of the whole thing. So I'm sure all of us continue to strive to be that way at one level, though at times economic compulsions have forced us to actually start charging, and if you need to grow, we need to do it differently. But again, my father, they've done so well in England, set up Shanti. My grandfather is supposed to have read under the street lights in Mysore and got 3 gold medals. I mean, when I still remember my father taking me to Dot Ganesha temple and saying that there was no power at that time. We used to sit under that light there and study. And ನಿನಗೆ ರೂಮ್ ಕೊಟ್ಟಿದ್ದೀನಿ, ಲೈಟ್ ಕೊಟ್ಟಿದ್ದೀನಿ, ಓದ್ತಾ ಇಲ್ಲ. The usual thing we got all the time, yeah. But I think we are incredibly happy, certainly very privileged, because I think being born to that kind of pedigree and continuing and hoping to serve further is a dream, to be honest with you. Quite often, though the expectations are so high, I think we strive even further because we want to keep the flagship high and possibly grow even higher. And all of them have done the same. They've actually pushed the envelope way beyond what it has to be. And, we can't thank God enough that we are where we are just now, and we hope to go even further. Thank you.
Beyond these 2 examples, they're from a very unassuming and simple background, general practice. What kind of edifices were built? In today's era, there's another sterling example, and that is Mr. and Mrs. GUNASHEELA. I think where it has come to, from where it started, I think we should listen from her daughter.
Thank you, sir. I'm the second generation. They're all the third and the fourth, and but it's been a great journey, and it's also been difficult. Like Sanjay said, it's not easy to step into their shoes, and a lot of expectations are there. And if I feel that if I can do at least about 10% of what my mother did, because she was an iconic figure, and she was legendary. She had so many firsts to her name, and when she came back from England, she felt that she was working in Manivilas, so the only her passion was infertility. So the only thing that she could actually do was HHGs, and which was just an X-ray test of the uterus to see if the tubes were clear. And then people were getting pregnant, and then that kind of fueled her on. And then that was her passion, and her dream was to get on with trying to get women who are finding it difficult to get pregnant, make them pregnant and help them out with their pain. And so she did exactly that. And for a long time, the infertility part of our hospital didn't earn any money. It was the obstetrics that was actually funding the infertility part. And after which she had so many firsts to her name, and she kind of it was amazing. And like Dr. Sanjay said, that people come and say that, oh, this is the 3rd generation who's been coming here, and they bring their children and their grandchildren to be delivered, and then they have all these old tattered case notes which you actually look in and you see the handwriting there. And I remember so many of the doctors who actually have worked there, and it's a privilege to be born to my parents. I mean, for a long time, you kind of, they hold your hand and you walk in their shadows, and then slowly you develop your own personality, and you then start to make your own footsteps in the sands of time, I think. But it's been great. It's been difficult. It's not easy to follow in the footsteps of a legend. There's too many expectations. But hopefully, if we can do at least 10% of what they have done, I think we have succeeded.
Their vigor was exemplary. I knew them well because they are more recent. I was pretty close to them. Your father, I used to meet him every month in the Surgical Society of Bangalore meetings. But unforgettable people. And here comes Padmini Isaac. Mary Ratnam Isaac, I think what one person can do in that era, the bandwidth is unlimited. I mean, we just do gynecology, we just do cardiac surgery, we are very happy. But, you know, her hand was in everything. So some anecdotes.
Dr. Ratnama Isaac was the first lady surgeon of Karnataka. She was born in Bangalore. She was born to a Tamil Christian family. She started her life as a teacher because she wanted to do medicine, but they couldn't afford it. But she was married to Mr. J.R. Isaac, and he sent her to Madras Medical College and then to the UK to do her MRCS and FRCP in those days. She came back and worked in Vani Vilas till she retired. And then she started Ratnama Nursing Home in Rangarao Road. And now she not only was an excellent obstetrician, she was a very avid social worker and very much interested in women's health. She founded the Abhaya Ashram with the support of the Maharaja of Mysore for providing shelter and educational opportunities for thousands of women and girls. She used to bring girls from the villages, train them as they would be dyes or they would know nothing, and should train them in midwifery, send them back to the village so as to improve their obstetric care in villages. She also provided comprehensive support, including job training and legal advice and medical care to vulnerable women. She is one who kept her family close to her heart. She had all her children and grandchildren always with her. And so the Isaac family is well known for their unity and enjoyment of life. She has had left behind. Her daughter was Dr. Rani Christopher, who was the Joint Director of Health. And her granddaughter-in-law, that is me, who's an obstetrician. My son is a professor in Ramaya Medical College. Another granddaughter of hers is the head of pathology in Mumbai. She has two of them in the USA who are physicians. She has a very large family of doctors. She has really inspired a lot of people to do lots of work. She did lots of free service. She did the Stri Stanga she used to go to. Where is that? She trained in the local, where is that, ma?
It's midwives. She had a band of midwives trained when gone to the interiors of Karnataka.
Yeah. She trained the villagers in midwifery and conducted extensive social work in the nearby communities. She conducted a weekly clinic at Basunguri Stri Sangha, benefiting women from many strata of society. She was awarded the Padma Shri. Where is her Padma Shri? In 1989 for her, Sorry. She received the Padma Shri Award in 1959 for her significant contributions to the healthcare of social services. She delivered the Maharaja of Mysore's children, and like that, she was that kind of very famous and very good doctor.
1959 was the pinnacle of her life, but she came from the 1800s. Can you imagine what was women's position in Indian society in 1800? And here is a lady who goes abroad, studies, comes back. I think just a couple of decades before that was India's first lady who went abroad and came as a doctor and joined, was Anandibai Joshi of Pune. And the story we all know. It's very inspiring actually. If you look at 3 people in that batch of women from Philadelphia Medical School were from Asia. One was Anandibai, who came back to Pune, and she was so much decorated. She was given such fantastic position. There are movies made on her. There are TV serials made on her. At the same time, there was a lady called Istanbuli from Syria, and she went back. It was a glorious thing to go back to the country, and the fundamentalists killed her. And then there was another lady from Japan, Keiko. Keiko went back to Tokyo and was much discriminated because it was a very paternal society. And then she was given a job and her of a gynecologist in a very dingy corner of the hospital. When the Japanese emperor came to see the hospital, he refused to see her because she was a woman. And this insult was so bad for her that Keiko committed a suicide. So that's the difference between the kind of India was, though we were so impoverished, we were under slavery, we were different. And see, examples like this are so sterling examples. So let's start from that side.
Let me,
yes.
to give me a minute or two, since Devika is sitting next to me. Devika's mother, Salochana GUNASHEELA, was delivered by Ratnama Isaac in Ratnama Nursing Home.
That's a good one.
And my daughter, Ratna Isaac, was delivered by Salochana GUNASHEELA in her nursing home. My son.
Let's start from that. So Visham Singh's place.
Good evening, everyone. I am Dr. Sarath Chandra. Yeah, from Sam Singh Nursing Home, Gandhi Bachar. There is nothing I can tell you. All I have to tell was spelt by all the other doctors who are sitting on the dais. See, honesty is the one which we have to deliver to the patients. Patient's welfare is the utmost thing which we want to. My grandfather started his practice in pet areas, and my father continued it at RT Street, Bangalore. And I took over the clinic in the year 1979. And 1987, I constructed the nursing home in Gandhi Bazaar. It's all the hard work and the sincerity to the profession which brought me from clinic level to the nursing home level. So we should do justice to the patient. I request everyone to do it. I don't want to take more time. Thank you so much.
Thank you, sir. We are not talking about Bangalore. We are just talking about a small community of Bangalore, Baswangudi. But post-plague, like Baswangudi came up, also came up Malleshwaram. Almost same style, same frame, and they have their own greats. So such is the legacy of Bangalore. And, sir.
Thank you very much, sir. I'm Dr. Ramdas. I'm a homeopath. Today's theme has been legacy, how to carry on the legacy. That's the theme. So in this context, I would like to share some of the experiences my father went through. I am on the other side of the practice of medicine. Now things have been very integrated. People welcome all systems of medicine, accept all systems of medicine. They know their limitations, they know the strength of other systems of medicine, which has been welcomed, and we welcome the same thing too. Just to get back to the legacy part of it, my father was a simple worker in Bombay at railways. This is in around 1910, around that time. So because my mother developed some puerperal hysteria, there was one famous accountant general in Bangalore, one TSIR, who was also an ardent follower, practitioner of homeopathy during those days. And my father came all the way bringing my mother to Dr. Iyer. So he studied her entire case from the homeopathic perspective, and he just gave one dose of medicine. He said, you can take her back. He said, no, now she's been suffering for so long. Now you have to wait and watch. He said, no, you come after 3 months. And she totally got cleared of that hysteria. So that is one part of it. My father, who was a passionate reader, and who always wanted to look into service. He had something in his mind all the time. And for him, he himself developed some duodenal ulcer. Again, Dr. T.S. Iyer to the rescue. Then he decided railway is not my cup of tea. I have to wind up. And believe it or not, 1935 he comes to Bangalore, winding up a central government job with the family. And then he studies homeopathy. 1939 he established our clinic. Now I am the second generation, and I have seen him. He is a no-nonsense man, very determined but very assertive, and very clear in his perception. And he devoted his entire thing to the family, like others were telling whether to ask the money. I know that I have seen him when some poor lady comes, a vegetable vendor. She says, she takes the medicine and keeps one piece of kothambari soap. Yes, he would accept it. For him, service was the motto. I mean, it was imbibed in him, and because I have witnessed that, I think if I have to carry the legacy, and that has come to me, and I have been practicing since 1972 now. It's about 51 years. So, I hope the same legacy will, my son has taken up the same course now. Fortunately, the education pattern has transformed radically. There is a standardized education pattern of 9 years for the MD, 5.5 years for the undergraduate. So, I hope the juniors or the new doctors will continue with this legacy, and I wish them all the good luck. And thanks for the opportunity for me to share here.
Thank you.
Thank you.
Talking about legacy, Maya, one is thank you very much for doing this curity work. It's fantastic. There could be some more add-on as you get more antique information, pieces, pictures, reels. But it has to be made permanent. Either, and it should not, it's very easy to think that IMA Hall or the API Bhavan, but there the public footfalls are not there. It's only doctors who will go there. It has to be a public domain thing to inspire. So it has to be in a public place. So I think you could talk to Dr. Tejasvi Surya. He would definitely come up with a creative idea. Or talk to Chandrama Sagar's family. They have so much of public spaces, people, footfalls are happening. They could create a long corridor. In Cleveland Clinic in Ohio, there is a huge corridor called Women in Medicine, or America. Great women surgeons, etc. And it's a very oft, people don't have any work in Cleveland Clinic. They would go and just to watch that museum. But in some form, a permanent museum, a book, and online presence. So let's go to the other end. And let's start from you, ma'am.
Yeah, I'm honored to be invited for
Honored,
this. Yes.
Yeah.
Yeah. I'm the part of the family in the sense that, I'm the cousin of late Dr. Chandrama Sagar, and her mom and my mother were sisters. Yes. So from the childhood, in the sense there is a lot of age difference between late Chandrama Sagar and me, but always I used to look upon her to say that when do I'm going to be like her. Yeah. That was always a dream in me. So my mother used to always observe that in me, because out of 7 siblings, and I am the only one who became a doctor. And in Dr. Chandrama's family, she was the one. Her sister was also a doctor, but Dr. Chandrama is the only one who had a triple FRCs, and she was looked upon very high those days. And she was a personal physician to Governor of India.
In those days.
In those days. So imagine so much of age difference. I was just wondering when I will get a chance to be with her, to work with her, to get trained under her. But it was very unfortunate that I could not get it. By the time I finished and my post-graduation come, well, she was no more. But she has my, in the sense the nephews, I can say that Dr. Hemachandra Sagar and Premachandra Sagar. Unfortunately, due to sort of unavoidable circumstances, they could not make it. But when they invited me to represent the family, I said, wow, really, yes. So I did follow her footsteps because I had heard a lot. As a student, I had a chance to go and sit very far away from her because she used to be very, very meticulous, very organized, and people would I would be very scared to go even near her. My mother used to say, go and ask her if you have any doubts, because I was a medical student. I said, no, I would sit far away. And I can just remember one incident, and I was almost closer to final year, and she gave me a chance to take care of my auntie, that is Chandrama's mother, who was already, sort of very sick. And I used to be very scared even to check her blood pressure also, my aunts, because she would say, you must keep the record, everything, I'll come and check you, because you are going to serve the people tomorrow. You have to be a perfect doctor, like that. So with her, sort of keeping her image in my mind, I said that I want to become an obstetrician and gynecologist. Though I did not work under her, I did not get her whatever, sort of her legacy, what I have to say that. But in my own way, I grew under her shadow. I have to say that. In my own way, I said, let me be like her, but it is not possible to sort of to be like her. But I'm very fortunate today to work in Saga Hospital for the past 22 years after return back from abroad. And I am there from day one, inception of Sagar Hospital as an obstetrician gynecologist. And both the brothers have so much of confidence in me that for everything they think that, and I carry their mother's sort of legacy. But I don't have to, I don't want to say that I have carried a legacy like that, but at least a small percentage, people come and just, it happened 2 hours before. Dr. Padmini Isaac said, how are you related to Chandrama, Dr. Chandrama? Then Dr. Vidyamani had to explain to her that how Indira is related to Dr. Chandrama Sagar. She said, we are contemporaries from Bangalore Medical College, very close friends. And she said, why didn't you tell me this, that you're close relative, cousin of Dr. late Chandrama Sagar? I said, I don't know. Probably I developed my own identity through her image. And today I'm very, very proud to be sitting amongst the people, who are carrying your, sort of parents' legacy. Me sitting here representing the family, the brothers could not come. And then I am given a chance to talk about late Dr. Chandrama Sagar. Thank you very much. Thank you very much for the opportunity given.
I think you could help. I will tell Hemchandra was my student in his general surgery days. So I think you all could help to create this permanent small exhibit of Baswan Gudi's medical legacy. And I think that could be very nice. So with those anecdotes, sorry. No, I just saw him and...
So our hospital was started by my great-grandfather, Dr. B.K. Narayan Rao.
These are the huge legacy.
So first of all, before I start about our legacy, I would like to congratulate Madam Maya Chandra for this wonderful concept. Many of the people whom we saw over here are people whose stories we have heard in the dinner table. They were the heroes. For me as a child growing up, these doctors were the heroes. And each one of them was such a perfect example of how life should be lived, that, you don't need any other book of philosophy, you don't need anything else. You just saw them living their lives, and that was ample enough for you to, adjust and decide how you want to live. So great-grandfather came from a small village in Arkalgud Taluk called Baswapatna. And in those days, he went to the Madras Medical College, finished his MBBS training there. And then he worked in the Madras government service. And he had worked with the great Donovan, who discovered the sandfly transmits the leishmaniasis. And then subsequently his bosses encouraged him, why don't you go to England and train there and come back. So training in those days in England wasn't, they wouldn't give you surgical opportunities or anything. You would go there, take the exam, observe and come back. And then you would read and do things. So he went there, trained and came back. He also did an ophthalmology training. He was a general surgeon and an ophthalmologist. And when he came back, soon after, he moved to Mysore. And he was fortunate to operate upon both the mother and the aunt of the Krishnaraja Vadiyar Bahadur. And he became very close to the Mysore royal family. He was also given the responsibility of the Minto Eye Hospital. So for 17 years, he headed a Minto Eye Hospital as the superintendent. I don't think anyone has such a long tenure. And while he was there, he was also the president of the National Education Society. He was one of the founder members of the Indian Academy of Sciences, which Sir C.V. Raman started. And post-retirement, he and some of his friends, Dr. Shafiullah Mekri is there, Dr. B.V. Ramaswamy's family is there, and Parvati is there, Dr. Shivram's granddaughter, and all of them together decided that Bangalore doesn't have a medical college. So earlier, Mysore Medical College started in Bangalore. So great-grandfather was the second principal of the Bangalore Medical or Mysore Medical College in Bangalore. And subsequently, it shifted to Mysore. So they decided, 5 private people decided to start a medical college. They went door to door, house to house, saying, give us 2,000 rupees, we assure you 1 medical seat. Raised the funds, created the medical college, ran it for 3 years, made sure all permissions were got, and handed it back to the government for 1 rupee. You can't imagine that kind of. They had put in their time, effort, and built an institution. And it's so surprising when you look at it. So many institutions which he was associated with, Bangalore Medical College, All India Ophthalmic Society, and all these he started. And all of them are still running. And so is Prabha Clinic. We are very proud of that too. So, under the able leadership, we are 3 brothers, and my brother Vinay heads the organization as the medical director. My other brother Krishna heads the organization, our charitable wing, Vitala. Now, after great-grandfather, my grandfather continued the legacy. He was the son-in-law. So it's very interesting. So because my great-grandfather had crossed the seas, so he was excommunicated by his community, which was a very conservative Brahmin community. So he was not very bothered because they would still come and take treatment and he was useful to them. But when the time came for him to marry his daughters off, that was the difficult time because no one was willing to give a boy for his daughters. So he thought of a sort of a plan where he sponsored the education of many of young children and also got his daughters married to them. So my grandfather had finished his BSc. He got a chance to study medicine because great-grandfather supported him. And later on, he inherited the Prabha Clinic. It's an interesting story, slightly longish but worth listening. So when grandfather was in government service, he wanted to leave it. And his father-in-law warned him and said, if you think you can inherit my practice, you neither have the qualifications nor the capability to get this. And nevertheless, my grandfather gave up his government service, came to Bangalore. He started a small clinic called Crystal Eye Clinic on Brigade Road and in Sheshadripuram. And mornings he would assist my grandfather in Prabha Clinic on Vanivilas Road. And one day, great-grandfather had gone for an eye camp. And when he returned, grandfather handed him the purse saying that this is the earnings. And he said, how come so much? I said, no, I operated one set of patients, discharged them, and next set I have operated. So he went around the whole hospital, saw each patient, walked back, took out the keys of the hospital, handed it to my grandfather, and walked out. And thereafter, he never came back to run the place. So it is. So, and from next, my father, he was simply legendary. I mean, people who have worked with him, if you spent 1 hour with him, you would think ophthalmology was the only thing worth doing in life. He was so inspiring. And he had such a photographic memory. He would remember everything. I remember my pathology exam. I came back. We were all very upset because they had asked one stain which was nowhere given in any of the textbooks we were reading. So he came back. He was having lunch and he said, no, they've given something which is totally out of the portion. That, medicine again portion irutte. So then I said, Nodi, stain in Robinson Lilla, a big fat book. He just looked at the question paper and he said, Benjamin Boyd, page 805, left-hand top corner. I was astounded. And I went, there was this Benjamin Boyd, I picked it up and looked, page 805 on the top left-hand corner, that stain is mentioned. That was the level of his, this thing. He was simply brilliant, and across ophthalmology, anything. He was a pole-to-pole surgeon and beyond. He could do very good oculoplasty, great glaucoma work. He was one of the first people in the country to do trabeculectomies. There are so many firsts. Vitrectomies, he started in Bangalore. I think the second institution in India to start vitreoretinal surgery, vitrectomies. And he used to be great at everything. And very, very inspiring man, and at the same time extremely humble. Sometimes when he was going out, if even a poor patient who was a free patient who walked in, he would come back from the car, treat that patient and go. So these are the things which we imbibed from them. And really it is a privilege to be born in a family like this and inherit this legacy. We hope we have 2 more little ones who are the 5th generation who are training and a few more in the wings. So I think if they can get this humanity which they have got. And before I finish, I would also acknowledge from my maternal side, Sin Mama or Srinivas Murthy, who was my mother's uncle, was also a practitioner in Baswangudi. And so I inherit this is a medical profession from both sides. So thank you.
This stories of high bandwidth, one person doing so many medical feats. I remember when I was a student in Bombay, I had a godfather who was not in my institute, he was in Bridge Candy. He was a doyen of Bridge Candy, but he was fading off in his career. And his OT list was to be very peculiar. He would do a hip replacement, followed by maybe a hernia, then a mitral valve replacement, a bypass surgery, and then he may get a call for emergency cesarean section. So we came from people like that. But look at these Baswangudi stories, just Baswangudi. And
one small,
sure.
I would also like to remember my grand uncle, Dr. B.K. Narayan Rao's first son, B.N. Balkrishna Rao. Like Sir said, he was one of the greats in our family. I mean, what he has achieved is phenomenal. He was a great surgeon. He performed the first neurosurgeries in India. He went on to head the Gajraraja Medical College in Gwalior. And I met a person from Gwalior, and he said, you know, your grand uncle was the only person in the entire kingdom of Gwalior who would address Jivaji Rao Scindia as Mr. Jivaji Rao. All of us used to say Maharaj, and he would say Mr. Jivaji Rao to him. He was, if he got down from the train, people would part, the crowd would part to allow him to walk. And then when AIMS was started, he went on to head the surgery department in AIMS. and so many things which he achieved in his life. And he came back and settled in Baswangudi on the Vanivilas Road, opposite Geeta Nursing Home. And he never did a private practice in his entire life. He was always an institutional man, teacher. And I always remember this one instance. I went to his house with my father and he handed me the paper which was written, which he was an editor for the Surgical Journal, international paper. And he said, read it and tell me what you feel. So I quickly glanced through the paper and I was trying, what does it prove was his question. I looked at it and I was trying to come up with some intelligent answer. And he said, it proves that fools are equally distributed in the world. So that was his sense of humor.
So these inspiring stories of medical legacies of Baswangudi. Tremendous hard work, which you can see. The message for the youngsters is big thinking and risk-taking. And more importantly, understand that you are limited only by your imagination. So I think this was a very inspiring evening, Maya.
Apart from the galaxy on the stage, we have many of the families present in the auditorium here today. Just throw open for a few more minutes about any stories that is coming across from the other side of the audience. Divya Raghuram is the granddaughter of Dr. B.V. Ramaswamy, the very, very famous Dr. B.V. Ramaswamy clinic. And Divya, you're the granddaughter. And of course, Divya, you must all be knowing, is one of our most renowned musicians in Karnataka. She's a singer and had a great pleasure of being a very good friend with her. Divya, your thoughts on this whole legacy?
Thank you, Maya. Very good evening to all the doctors here and to everybody here present. I'm here to represent my grandfather. His children, Dr. Madhusudan and Geeta, my mother, are here, but they are they don't want to be in the limelight. So I was just pushed to talk. Lot of memories about my grandfather. Of course, unfortunately, his grandchildren, none of us decided to take up medicine, but the next generation, I have my niece who is in her first year of medicine, and we're all so happy about that. Yes, a lot of things to learn from him, but I think the most important thing what I have learned is his humility and his dedication to his field of medicine. I remember a lot of instances where we would be sitting on the table having lunch, and if there was a patient a lot of patients would come home. So he would not wait to finish his, food. He would immediately get up and go and be there to attend to them. And I've also seen him go personally to a lot of patients. A lot of them, were saying, "Yuru, namma family doctor hege andre avaru manevargu bandu namanna attend ಮಾಡ್ತಾ ಇದ್ರು." So that was the kind of dedication. Also, he was very popularly called as the Childre doctor because hardly any his fees was very, very little, and he would always walk back home from the clinic to 20 Market Road, which was where he was living, with a pocket full of yentani nakani, things like that. So I'm very sure that my uncle, his older son-in-law, who took up the clinic, very sure it was very difficult for him, like so many of you have mentioned here, that for them to fill up his shoes. I have a few words which my uncle, Dr. Madhusudan, wanted me to read out. He likes to acknowledge and also share a few thoughts about accomplished doctors who have influenced him and included inculcated values in his practice. Apart from my father, Dr. B.V. Ramaswamy, I would like to offer salutations to Dr. K.S. Srinivas Murthy, whose children are here. Dr. A. Chandrasekhar, Dr. M.E. Narsimachar, Dr. B.P. Lingappa of Geeta Nursing Home fame for his single-minded dedication, Dr. K. Krishnamurthy, renowned teacher and surgeon, Dr. M.N. Subramanya, famous surgeon and teacher, Dr. M. Gurudas, founding father of radiology in Victoria Hospital, who has influenced Dr. Madhusudan, and to take up the dark room profession, as he called it. Dr. H. Krishnamurthy of Prabhai Clinic fame, Dr. Chandrama Sagar for his simplicity and compassion, Dr. K. Guraj Rao for his inimitable bedside manners, Dr. GUNASHEELA, whose unending quest for knowledge has inspired him. Last but not least, Dr. B. Ramaswamy's son-in-law, Dr. A.P. Vasudev, who carried on his legacy of family practice till he retired a few years ago. Though I've been a musician for last 25 years and I get recognized, it gives me great pride when people get to know that I'm Dr. Ramaswamy's granddaughter, and that actually makes me more happy than whatever I have achieved. So unfortunately, as I said, my cousin is also here, Dr. Madhusudan's daughter. None of us took up medicine, but we are all very, very proud, and we have imbibed a lot of values from him. Thank you so much.
Thank you, Divya. That was lovely. In fact, Dr. Ramaswamy's family was the very first to send me the pictures as soon as I contacted them. I got all the pictures. It was very fascinating. I think we have some more families who would like to say a few words quickly.
I just wanted to add to that. My grandfather, Dr. B.V. Ramaswamy, passed away when I was 6, so I was very young. But my most prominent memory of him, a legacy he has left behind for us, even though we're not medical doctors. He gave both me and my brother a stethoscope, his stethoscope, to carry forward, which I'm so grateful and privileged and happy that I still have it with me. Of course, I don't know if the generation forward, I have a niece who's in medicine at KIMS, so hopefully something to pass on to her. But who knows, our children, if they do take it up, it's a wonderful thing to pass on to. And it is, now it's 30 years since he passed away this year. He passed away in 94. And to still see stories from his patients on Facebook and on Twitter about their experience with him is truly moving and truly touching, and we're so grateful to have his memory passed on in that way. So thank you all so much for that, and thank you for honoring him. Thank you.
Thanks to the family. Anybody else? I think, there were a few people from the Dr. Nagama's family who are also here, but who are not medical professionals. Are they here? Not able to. And of course, Dr. Radha, the liver clinic on DVG Road, their family has come in, and her nephew, Varuna, has come in all the way from Mysore to attend this event. And he was also one of the first to share all the photographs of Dr. Radha, one of the most legendary lady doctors of our area who ran the liver clinic. And just throwing open the audience for a few questions in a few minutes, and then we can wrap up in another 5-10 minutes. Any questions for all the leaders sitting on the stage?
Madam, namaskara. ನಾನು ಕನ್ನಡದಲ್ಲೇ ಮಾತಾಡ್ತೀನಿ. ರಾಮಸ್ವಾಮಿ ಡಾಕ್ಟ್ರ್ ನಮ್ಮ ತಂದೆ ಕಾಲದಿಂದನೂ ನಮಗೆ ನಮ್ಮ ಫ್ಯಾಮಿಲಿ ಡಾಕ್ಟ್ರು. ನಾನು ಎರಡೇ ಮಾತಲ್ಲಿ ಹೇಳ್ತೀನಿ, ನನ್ನ ಮಕ್ಕಳಿಗೂ ಅವ್ರ ಹತ್ರ ತೋರಿಸ್ಕೊಂಡು ಹೋಗ್ತಿದ್ದೆ. ಎಷ್ಟರ ಮಟ್ಟಿಗೆ ಅಂದರೆ ನಮ್ಗೆ ಹುಷಾರಿಲ್ಲ ಅಂತ ಅವ್ರ ಕ್ಲಿನಿಕ್ ಹೋದರೆ ಅವ್ರನ್ನ ನೋಡಿದ ತಕ್ಷಣ ಒಂದು 80% ಕಾಯಿಲೆ ವಾಸಿ ಆಗಿಬಿಡೋದು. ಆಮೇಲೆ ಅವರು ಮಿಕ್ಸ್ಚರ್ ಕೊಡೋರು, ನೋ ಟ್ಯಾಬ್ಲೆಟ್ಸ್, ನಥಿಂಗ್. ಅದು 3 ದಿನ ತಗೊಂಡು ಏನಾದರೂ ಇದ್ದರೆ ಬನ್ನಿ, ಇಲ್ದಿದ್ರೆ ಬರಬೇಡಿ ಅನ್ನೋರು. ಆ 1 ಡೋಸ್ಗೆ ನಮಗೆಲ್ಲ ಖಾಲಿ ಆಗಿಬಿಡೋದು, ತೊಂದರೆ ಇರೋದು, ವಾಸಿ ಆಗಿಬಿಟ್ಟಿರೋದು. ಆ 3 ದಿವಸ ಕಂಪಲ್ಸರಿಯಾಗಿ ತೊಗೋಬೇಕಲ್ಲ ಅಂತ ನಾವು ಔಷಧಿನ ತೊಗೋತಾ ಇದ್ವಿ. ಅಂಥ ದೊಡ್ಡ ಮನುಷ್ಯರು ಅದೇನೋ ಹೇಳ್ತಾರೆ, ವೈದ್ಯೋ ನಾರಾಯಣೋ ಹರಿಯೇ ನಮಗೆ ಇದ್ರು. ಧನ್ಯವಾದಗಳು ನನಗೊಂದು ಅವಕಾಶ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ.
Anyone else? Yeah.
Good evening. My name is Jayant, and I happen to have the privilege of being the grandson of Dr. B.N. Balkrishna Rao, whom Praveen already referred to. I work here in the Indian Institute of Science, but I just wanted to share an anecdote about my grandfather, which exemplifies the kind of high thinking they had at those times. So, as Praveen already mentioned, he was the principal of the Gwalior Medical College, And one night, what suddenly happened was that in those days, there was rampant feudalism in the state of Madhya Pradesh. And you would know that in the Chambal Valley, there was a large number of dacoits. The dacoits came and actually kidnapped him from home and went and took him to their caves and said that you need to treat one of our compatriots who has been injured in one of these battles with the government. And he actually did that, and they were very happy with him. And they actually gave him a ring, saying that if you wear this ring, you can always pass through all our regions without any difficulty. But when he came back, this came to the attention of the Madhya Pradesh government, who were absolutely furious, saying that why are you helping our, in a sense, enemies? They are enemies of the state, and you are going and helping them. And the answer that he gave, which I think would resonate with all the doctors here, is that he said the Hippocratic oath trumps all government laws. And that was it. Thank you.
Fantastic story.
I'm Dr. Vidyamani. I don't belong to Bangalore, but I came and settled here because I got a job in Kempegoda Medical College as assistant professor. First, I knew Dr. Chandrama Sagar for a very short while. Her husband, Dr. Mr. Dayan Sagar, and my father were very close friends. And so when they came back from England, I'm from Ooty, they came to visit us. And my father, I remember saying, I was still in school, and he said, look at this lady, she's triple FRCS, she's come back from England, and she inspired me so much. Like Indra Reddy said, I would like to become like her, and that inspired me to go to England and come back. And I'm glad to say now that I had my own nursing home called Lalbagh Nursing Home, which I wound out a few years ago, and I'm back in Sagar Chandrama Hospital, hopefully to carry the legacy forward.
Thank you very much.
And apart from that, I want to say a few words about Dr. Sulochana Gunasheela, because I was a newcomer to Bangalore. She literally inspired me in all ways of, practice. She would recognize anybody's merits, and she was so ethical and honest with her work, so that she'll be, you have to write books and articles and all that, and people copy. There's a lot of plagiarism and all that. I'll tease her. I say, Madam, why do you struggle so hard and read up so much? See, people want to know what I have done, my work. She was so original. That really inspired me a lot. And another thing about Chandrama Sagar, apparently she was very humble and very, simple. My mother told me once that she invited the present hospital, that's where their house was. She invited our family, and she cooked and she served. Everybody sat on the floor, and she made a point that she served them food, herself. So that's how I know Chandrama Sagar about. Thank you.
This is Madhusudan here from ಬಸವನಗುಡಿ. ಬಸವನಗುಡಿಯ ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ ನೋಡಿ ಭಾಳ ಖುಷಿ ಆಗ್ತದೆ. ನಾನು ಡಾಕ್ಟ್ರ್ ಅಲ್ಲ, ಬಟ್ ಇಷ್ಟೊಂದು ಲೆಗಸಿ ಕೊಟ್ಟಿದೆ ಅಂದರೆ ನಮ್ಮ ಮನೆಯಲ್ಲಿ ನಮ್ಮ ತಾತ ಅವರು, ನಮ್ಮ ತಂದೆ, ನಾನು, ನನ್ನ ಮಗ 4 ಜನ ಪ್ರಭಾ ಕ್ಲಿನಿಕ್ಗೆ ಅಲ್ಲೂ ಲೆಗಸಿ ಕಂಟಿನ್ಯೂ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ವಿಶೇಷ ಏನಪ್ಪ ಅಂದರೆ ಏನೇ ಕಣ್ಣು ಚಿಕ್ಕದಿದ್ರು ನಾನು ಪ್ರಭಾ ಕ್ಲಿನಿಕ್ಗೆ ಹೋಗ್ತೀನಿ ಅಂದರೆ ದಟ್ಸ್ ವಾಟ್. ಸೊ ಯಾಕೆ ಅದು ಬರುತ್ತೆ ಅಂದರೆ ನಮ್ಗೆ ಅವ್ರ ಮೇಲೆ ಎಷ್ಟು ನಮಗೆ ಅಷ್ಟು ಟ್ರಸ್ಟ್ ಫ್ಯಾಕ್ಟ್ರ್ ಅವರಲ್ಲಿರೋದ್ರಿಂದ ಬೇರೆ ಊರಲ್ಲಿದ್ರೂ ನಾವು ಐ ಆಮ್ ಫ್ರಮ್ KGF, ಬಟ್ ಯು ಯೂಸ್ ಟು ಕಮ್ ಟು ಫಾರ್ ಸ್ಮಾಲ್ ಚೆಕಪ್ ಆಲ್ಸೋ ಟು ಪ್ರಭಾ ಕ್ಲಿನಿಕ್. ಥ್ಯಾಂಕ್ ಯು ಡಾಕ್ಟರ್ ಪ್ರವೀಣ್, ಆ್ಯಂಡ್ ಫಾರ್ ಆಲ್ ದಿ ಡಾಕ್ಟರ್ಸ್ ಬಿಗ್ ರೌಂಡ್ ಆಫ್ ಅಪ್ಲಾಸ್. ಎಲ್ಲ ಡಾಕ್ಟರ್ಸ್ಗೂ ಲೆಗಸಿ ಕ್ರಿಯೇಟ್ ಮಾಡೋದು ಈಸಿ, ಬಟ್ ಅದನ್ನು ಕಂಟಿನ್ಯೂ ಮಾಡ್ಕೊಂಡು ಹೋಗೋದು ತುಂಬ ಕಷ್ಟ. ವೈದ್ಯೋ ನಾರಾಯಣ ಹರಿ, ಒನ್ಸ್ ಅಗೇನ್ ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
Thank you, Madhusudan. Dr. Gauri Murthy is also here in the audience. She's sitting way in the back.
Thank you. I'm not originally from Basavangudi, but I live in South Bangalore. Been in Bangalore for over 52 years. My name is Dr. Kalyan Sundaram. I'm a psychiatrist. To be part of this legendary evening is something which I cherish. Although I came to know a little late in the day, I was very keen not to miss this event. Several of them I know, they themselves are legends. The chairing the session himself is a big legend to all of us, we know that. Small anecdotes about 3 people whom I've known. Dr. Vivek Jawali said, I am a generation below them, but above many of them here. Dr. H.S. Subramaniam, as some of you mentioned, he's mentioned that the first private psychiatrist to start a private psychiatric nursing home. A very bold move. Only man of his caliber and confidence could have done that. I have known him during my studentship from Nimans, and when he went away to UK for a brief program, by then I had quit Nimans. He said, Kalyan Sundaram, you come and sit in my clinic and see my patients. You are not anyone who will say no to Dr. Subramaniam. And he said, sit in my chair and charge what you want and go. The man was generous to a fault. I know several of his students who wanted to go to do this ECFMG to go to UK, USA. He would very generously put his hand in the pocket, hand over the money, did not even expect to be returned. I think he was a legend, not as a professional, but as a human being. Dr. K.R. Murthy, what do I say about him? Compassion oozing everywhere. And you see him, your sights get better. And I still cherish, of course I see his son these days. He got my sight better after the cataract surgery. I still carry the yellow card prescription, the size of a postcard, where he would write every follow-up that was done. And when I took to see him one day and showed it to him, there were tears in Praveen's eyes. And I still keep it as a treasured item in my file, which continues to be with his professional inputs. Dr. K.R. Guraj Rao. I quit Nimans in 1981 because those days the salary from the government services was atrociously low. As an assistant professor, I was getting 4,000 rupees a month. And we four of us decided to quit Nimans, some of them, Dr. H.V. Sinha, Dr. Deshpande, Vidyasagar and myself. I did not know where I was going to start practice. Practice was anathema to me. Then Dr. Guraj Rao used to live down the road in the same house. Sanjay was too small, he could not even come to my knee size in those days. And he called me and said, I'm starting a Shanti nursing home. Why don't you come and join me? Who would tell this to a person who is total stranger, didn't know anything about it, and he invited me. I've been with them for 43 years. I have been a confidant on one side to the father and confidant to the son on the other side. But the care and the affection that he showed. He would sit in a clinic and you'll have 3 or 4 patients all at the same time. He would talk to somebody, auscultate on somebody else, and then, as someone mentioned, Guraj doctor note takshana kailala ottokta swami. Now that is the, and small point again, some of the patients would come, I'm one of those sticklers with appointments. Some of those patients in the 60s and 70s would come and say, I want to see you. So do you have an appointment? Yes, Swami, appointment kelta idira. Nan Ramarao patient, gotta. Now that is a kind of a confidence and love and affection with which they would walk in and ask for it. As you said, there are generations of people who come to see them, and very happy to see all the 3 people I have mentioned, whom I have known personally the next generation. They're carrying on their work absolutely assiduously, and God bless all of you. Thank you for this opportunity.
Thank you. Thank you all. And if there are no further questions, somebody's...
Yeah, I would like to say a few words. My parents, we lost them just last year. We lost my father previous last year, my mother. I'm Dr. Ramesh from AV Hospital. So both my parents were professors here. Unfortunately, in 1979, my mother met with a major accident. She went into quadriplegia. Padmini madam is my mother's student. My teacher, Vivek sir, is a mentor for me. So they had a tough time. 2 months after her accident, she was just recovering, and both of them were transferred to Hubli. But in Hubli Medical College, there was no physiotherapy. They requested in the government not to transfer, but it was not possible to cancel the transfer. So they had to take retirement, and so we rehabilitated ourselves starting Anugraha Vitala Hospital here. So it's 44 years now. But then my father, being in government service all the time, he always wanted to do something small, but then do it nicely. So he started with 3 principles. First and foremost, he said, good and ethical care at reasonable cost. Number 2, he said, you have to, patients come in difficulty, never try to charge them any money, treat them and then take money. So he said, no advance in our hospital. Then the third thing he said was, you have to grow with the goodwill of patients. So no marketing department. So 44 years from now, I mean, since they started, we lost them in the last 2 years, but then we still hold to those same principles. We don't take advance from any patient. There's no marketing department. And he started a diabetic clinic. Every Tuesday, anybody comes, it was free. Lot of rich people would also come, but there was no differentiation. So consultation, lab charges, and then sometimes medicines, everything was given free. For 30 years, he ran the free diabetic clinic. So these are some things. Of course, the 2 doctors of that generation became 4 doctors in the next generation. And then the next generation became 6 doctors.
Wow.
So we're trying to continue that legacy. Thank you.
Thank you, Dr. Ramesh. And thank you all for having, yes, one more person is there. I think one more was here. Yeah, in the 4th row.
ಗುಡ್ ಈವ್ನಿಂಗ್. ನಾನು ಕನ್ನಡದಲ್ಲೇ ಮಾತಾಡ್ತೀನಿ. ಈ ಒಂದು ಕಾರ್ಯಕ್ರಮ ಆಯೋಜಿಸಿದ್ದಕ್ಕೆ ನಿಮಗೆ ಹೃತ್ಪೂರ್ವಕವಾದ ಅಭಿನಂದನೆಗಳು. ಬಸವನಗುಡಿಯಲ್ಲಿ ಸುಮಾರು 50 ವರ್ಷಗಳಿಂದ ಈ ಬಡಾವಣೆ ಪರಿಚಯ. ನಮ್ಮ ತಾಯಿ ಸುಲೋಚನಾ ಗುಣಶೀಲ ಅವರ ಪೇಷಂಟ್ ಆಗಿದ್ದರು. ನಾನು ಕೂಡ ಅವರ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ಹೋಗ್ತಿದ್ದೆ. ನನ್ನ ಮಕ್ಕಳು ಕೂಡ ಅಲ್ಲೇ ಹುಟ್ಟಿದ್ದು. ನಮ್ಮ ಫ್ಯಾಮಿಲಿಯಲ್ಲೂ ಒಂದು 5-6 ಮಕ್ಕಳಲ್ಲಿ ಹುಟ್ಟಿದ್ದಾರೆ. ಚಂದ್ರಮ್ಮ ಸಾಗರ್ ಹಾಸ್ಪಿಟ್ಲಲ್ಲೂ ಒಂದಷ್ಟು ಮಕ್ಕಳು ಹುಟ್ಟಿದ್ದಾರೆ. ಇಟ್ಸ್ ಅ ಬಿಗ್ ಫ್ಯಾಮಿಲಿ. ಸೊ ಆ್ಯಂಡ್ ಅಫ್ಕೋರ್ಸ್ ಡಾಕ್ಟರ್ ರಾಧಾ ಕ್ಲಿನಿಕ್ಗೆ ಹೋಗ್ತಿದ್ದೆ. ಎಲ್ಲಿ ಸ್ವಲ್ಪ ಟೈಮ್ ಇತ್ತು, ಜಾಸ್ತಿ ವೆಯ್ಟ್ ಮಾಡ್ಬೋದೋ ಆವಾಗ ಸುಲೋಚನಾ ಗುಣಶೀಲ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋದರೆ ಅರ್ಜೆಂಟಾಗಿ ಬೇಕು ಅಂದಾಗ ರಾಧಾ ಮೇಡಮ್ ಹತ್ರನೂ ಹೋಗ್ತಾ ಇದ್ದೆ. ಬಿಕಾಸ್ ವೆಯ್ಟಿಂಗ್ ಪೀರಿಯಡ್ ವಾಸ್ ಲೆಸ್. ದಟ್ ಈಸ್ ದ ಒನ್. ಆ್ಯಂಡ್ ಈಕ್ವಲಿ ಗುಡ್ ಡಾಕ್ಟರ್ ಇನ್ಸ್ಟೆಡ್. ಡಾಕ್ಟರ್ ಬಿ ವಿ ರಾಮಸ್ವಾಮಿ ಅವ್ರ ಕ್ಲಿನಿಕ್ಗೆ ಹೋಗ್ತಾ ಇದ್ವಿ. ಬಟ್ ಒನ್ ಆರ್ 2 ಇನ್ಸಿಡೆಂಟ್ಸ್ ಟು ರಿಮೆಂಬರ್. ಒಂದು ದಿವಸ ಕ್ಲಿನಿಕ್ಕಿಗೆ ಹೋದಾಗ ರಾಮಸ್ವಾಮಿ ಅವ್ರ ಕ್ಲಿನಿಕ್ಗೆ ನಾನು ಚಿಕ್ಕ ಹುಡುಗಿ, 12 ಗಂಟೆ ಆಗೋಗಿತ್ತು. ಅವ್ರಾಗಲೇ ಕಂಕ್ಳಲ್ಲಿ ಅವ್ರ ಫೈಲೆಲ್ಲ ಇಟ್ಕೊಂಡು ಕ್ಲಿನಿಕ್ಕಿಂದ ಈಚೆ ಬಂದಿದ್ದರು. ನಾನು ಅವಾಗ ಬಂದೆ. ಅವ್ರಿಗೆ ಯಾವುದೇ ಇನ್ಫ್ಲೂಯೆನ್ಸ್ ಏನೂ ಬೇಕಾಗಿರಲಿಲ್ಲ. ಏನು ಅಂತಂದರು, ಏನೋ ಒಂದು ಜ್ವರನ ಕೆಮ್ಮೋ ಇತ್ತು, ಹೇಳಿದೆ, ಬಾ ಒಳಗಡೆ ಅಂತ ಕರ್ಕೊಂಡೋದ್ರು. ಇನ್ನು ಬೇರೆ ಯಾರಾದರೂ ಡಾಕ್ಟ್ರ್ ಆಗಿದ್ದಿದ್ರೆ ಆ್ಯಕ್ಚುಲಿ ನಾಳೆ ಬಾ ಅಂತ ಹೇಳ್ತಿದ್ರು, ಇಲ್ಲ ಸಾಯಂಕಾಲ ಬಾ ಅಂತ ಹೇಳ್ತಿದ್ರು. ಈವನ್ ಫಾರ್ ಅ ಸ್ಮಾಲ್ ಗರ್ಲ್ he took inside and gave medicine. So that is the one. ಇವತ್ತು ನಾನು ನಿಂತ್ಕೊಂಡು ಮಾತಾಡಬೇಕು ಅಂದರೆ ಆ ಇನ್ಸಿಡೆಂಟು ನನಗೆ ಜ್ಞಾಪಕ ಬರ್ತಾ ಇದೆ. ಅದೇ ಥರ ಸುಲೋಚನಾ ಡಾಕ್ಟರ್ ಅವರ ಕ್ಲಿನಿಕ್ಗೆ ಹೋದಾಗ ಕೂಡ ಆಫ್ ಲೇಟ್ ಸಮ್ ಫ್ರೆಂಡ್ಶಿಪ್ ಡೆವಲಪ್ ಇನ್ ಮೀ ಆ್ಯಂಡ್ ದ ಡಾಕ್ಟರ್. ಡಾಕ್ಟ್ರ್ ಅಲ್ಲದೇ ಇರೋ ಫ್ರೆಂಡ್ ನೀನೊಬ್ಬಳೆ ಅಂತ ಹೇಳೋರು. ಬಟ್ ಸುಲೋಚನಾಸ್ ಇಮ್ಯಾಜಿನೇಷನ್, ವಿಷನ್, ದೇ ಆಲ್ ಬಿಕೇಮ್ ಡಾಕ್ಟರ್ಸ್ for a cause and a reason. That is what I could see. Most of the doctors became doctors for a cause and a reason. ಅವ್ರು ಚಿಕ್ಕವರಿದ್ದಾಗಲೇ ಅವ್ರಿಗೆ ನಾನು ಏನಾದರೂ ಸಾಧಿಸಬೇಕು ಅಂತ ಅನ್ನಿಸ್ತಿತ್ತು. ಸೊ ಹಾಗಾಗಿ ಮೆಡಿಸಿನ್ ತೊಗೊಂಡ್ರು, ಮಾಡಿದ್ರು, ಎಲ್ಲ ಸರಿ. ದ ಒನ್ ಗ್ರೇಟ್ ಥಿಂಗ್ ಐ ಅಬ್ಸರ್ವ್ ಈಸ್ ಹರ್ ಗ್ರಿಟ್ ಆ್ಯಂಡ್ ಕರೇಜ್ ಇದೆಯಲ್ಲ. ಅವ್ರ ಹಾಸ್ಪಿಟ್ಲ್ ಕಟ್ಟಬೇಕಾದ್ರೆ ಗ್ರೌಂಡ್ ಫ್ಲೋರ್ ಕಂಪ್ಲೀಟ್ ಆದಮೇಲೆ ಫೈನಾನ್ಸ್ ಕಷ್ಟ ಆಯ್ತಂತ ಅವರಿಗೆ. ಫಸ್ಟ್ ಫ್ಲೋರ್ ಕಟ್ಟೋಕ್ಕೆ ಆಗಲಿಲ್ವಂತೆ ದುಡ್ಡು. ಆವಾಗ ಇಲ್ಲ ಇಷ್ಟಕ್ಕೆ ನಿಲ್ಲಿಸ್ಬಿಡು ಅಂದ್ರಂತೆ ಕಾಂಟ್ರಾಕ್ಟ್ರಿಗೆ. ಕಾಂಟ್ರಾಕ್ಟ್ರು ಇಲ್ಲ ನಾನು ಕಟ್ಕೊಡ್ತೀನಿ, ನೀವು ಆಮೇಲೆ ದುಡ್ಡು ಕೊಡಿ ಅಂತ ಹೇಳಿದ್ರಂತೆ. ಬಟ್ ಶೀ ಪುಟ್ ಎ ಕಂಡೀಷನ್, ನೀನು ಕಟ್ಕೊಡ್ತೀನಿ ಅಂದ್ಬಿಟ್ಟು ಹೆಂಗಂದ್ರಂಗೆ ಕಟ್ಟಂಗಿಲ್ಲ, ಒತ್ತಿಗೆ ಸರಿಗೆ ಮುಗಿಸ್ಬೇಕು, ಆಗತ್ತಾ ಇಲ್ವ ಹೇಳು. ಸೊ ದ್ಯಾಟ್ ವಾಸ್ ದ ಕರೇಜ್ ಶಿ ಹ್ಯಾಡ್. ಆ ಟೈಮಲ್ಲಿ ಫಾರ್ ದ ಪ್ರಾಕ್ಟೀಸ್ ಶಿ ಕುಡ್ ಹ್ಯಾಡ್ ಫೈನಾನ್ಷಿಯರ್ಸ್, ಶಿ ಕುಡ್ ಹ್ಯಾವ್ ಅಪ್ರೋಚ್ಡ್ ಫೈನಾನ್ಷಿಯರ್ಸ್. ಶಿ ನೆವರ್ ಡಿಡ್ ದಟ್. ಆ್ಯಂಡ್ that is some of the things we can see in the senior doctors, and it was possible in that time. ಇವತ್ತು ನಾನು ಹಾಗೆ ಇರ್ತೀನ ಅಂತಂದ್ರೆ ಪ್ರಾಯಶಃ ನೀವುಗಳು ಹೇಳಬೇಕು, ಬಹಳ ಕಷ್ಟ. ಇವತ್ತು ಪ್ರಪಂಚ ಬದಲಾಗೋಗಿದೆ. ನಾನು ಹಾಗೆ ಮಾಡ್ತೀನಿ ಅಂತಂದ್ರೆ ಆಗುತ್ತಾ ಇಲ್ವೋ ಗೊತ್ತಿಲ್ಲ. ಬಟ್ ಅವರೆಲ್ಲರೂ ಆ ಎಲ್ಲ ಡಾಕ್ಟ್ರುಗಳನ್ನೂ ಕೃತಜ್ಞತಾಪೂರ್ವಕವಾಗಿ ಜ್ಞಾಪಿಸ್ಕೊಳ್ತಾ ಈ ಒಂದು ಇವತ್ತು ಅವರೆಲ್ಲರ ಕುಟುಂಬದ ಸಮ್ಮುಖದಲ್ಲಿ ನಡೆದ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಧನ್ಯವಾದಗಳು ತಿಳಿಸ್ತೀನಿ.
ಐ ಥಿಂಕ್ ರೋ ನಂಬರ್ 4 ಮೈಕ್ ಕೊಡಿ
ಮೇಡಮ್. ಒಂದೇ ಒಂದು ನಿಮಿಷ. ಐತಿಹಾಸಿಕ ಪರಂಪರೆಯನ್ನು ಸೃಷ್ಟಿ ಮಾಡಿರ್ತಕ್ಕಂಥ ಬಸವನಗುಡಿಯಲ್ಲಿ ಈ ಎಲ್ಲ ಲೆಜೆಂಡ್ಸ್ ವೈದ್ಯಕೀಯ ಸಮೂಹದಲ್ಲಿರ್ತಕ್ಕಂಥವನ್ನ ತಾವೊಂದು ಒಳ್ಳೆಯ ಅದ್ಭುತವಾದಂಥ ಕಾರ್ಯಕ್ರಮವನ್ನು ಮಾಡಿದ್ದೀರ ಅಂತ ಮಾಯಾಚಂದ್ರ ಅವರಿಗೆ ಮೊಟ್ಟ ಮೊದಲಿಗೆ ನಾನು ಧನ್ಯವಾದಗಳನ್ನ ಅರ್ಪಿಸ್ಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ. ಈ ವೇದಿಕೆ ಮೇಲಿರ್ತಕ್ಕಂಥ ಎಲ್ಲ ವೈದ್ಯಕೀಯ ಕ್ಷೇತ್ರದ ಲೆಜೆಂಡ್ಸ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಹೋದರೆ ತುಂಬ ಸಮಯ ಆಗುತ್ತೆ. ಆದರೆ ಒಂದೇ ಒಂದು ಮಾತು ಹೇಳಬೇಕು ಅಂತಂದರೆ, ನನಗೆ 2 ವರ್ಷದ ಕೆಳಗೆ ಒಂದು ಹಾರ್ಟ್ ಪ್ರಾಬ್ಲಮ್ ಆದಾಗ ನಾನು ತಕ್ಷಣ 1 ನಿಮಿಷ ಕೂಡ ಯೋಚನೆ ಮಾಡಲಿಲ್ಲ. ಡಾಕ್ಟರ್ ಜವಳಿ ಅವರ ಮೂಲಕ CABG ಮಾಡಿಸ್ಕೊಂಡು ಇವತ್ತು ಅತ್ಯಂತ ಆರೋಗ್ಯಪೂರ್ಣವಾಗಿದ್ದೀನಿ ಅಂತಂದರೆ ನಾನು ಮೊಟ್ಟ ಮೊದಲಿಗೆ ಜವಳಿ ಅವರಿಗೆ ಧನ್ಯವಾದಗಳನ್ನು ಅರ್ಪಿಸ್ಲಿಕ್ಕೆ ಇಷ್ಟಪಡ್ತೇನೆ. ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್.
ಥ್ಯಾಂಕ್ ಯು ಮೇಡಮ್. ಲಾಸ್ಟ್
I just had one. Dr. Mahadevaya is a great person. I don't know if anybody spoke about him. He had Baswangudi ENT clinic here in HB Samachar Road. He was considered the #1 ear surgeon in the whole country, and he was such a simple man, and the whole country would come to learn ear surgery from him. And anytime you go to his nursing home, there were nobody, only patients would help patients. And whenever I go, patients' relatives would ask me, "What do you need anything?" Because Mahadevaya sir was most of the time in the operation theatre, and everybody would accommodate. It was such a nice, unique place, and he wanted it to be simple throughout his life, but still the best ENT ear surgery center in the whole country. That's one thing.
The one regret probably we have here is that many of the big names we are not yet able to cover. I think in the next edition we may be able to include them, because I know we have missed several people who we were not able to connect in this time period.
ನಮಸ್ಕಾರ.
ಇಲ್ಲಿ ಹಾಂ
ಇಲ್ಲೋ ಮಾತಾಡ್ಬೋದಾ?
ಹಾಂ, ಅಲ್ಲಿ ಯಾರೋ ಮಾತಾಡ್ತಾ ಇದ್ದಾರೆ. ಹಾಂ, ಎಸ್ ಮೇಡಮ್ ಹೇಳಿ.
ನಾನು ಡಾಕ್ಟರ್ ಲತಾ ವೆಂಕಟರಾಮ್ ಅಂತ. ಬಸವನಗುಡಿನಲ್ಲೇ ಹುಟ್ಟಿ ಬೆಳೆದು ಇಲ್ಲೇ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾಯಿದ್ದೀನಿ ಈಗಲೂ ಕೂಡ. ಸೊ ಐ ಹ್ಯಾವ್ ಬೀನ್ ಎ ಫಾಸಿಲ್ ಇನ್ ಬಸವನಗುಡಿ ಅಂತ ಹೇಳ್ಬೋದು. Quite a few doctors have inspired me to make me what I am today. ಡಾಕ್ಟರ್ B.V. ರಾಮಸ್ವಾಮಿ ನಂಗೆ ನೆನೆಸ್ಕೊಂಡ್ರ ಗೊತ್ತಿಲ್ಲ, ಜ್ಞಾಪಿಸ್ಕೊಂಡ್ರ ಅಂತ. ಇಲ್ಲಿ ನಾನು ತುಂಬ ಲೇಟಾಗಿ ಬಂದಿದ್ದೀನಿ. ಡಾಕ್ಟರ್ B.V. ರಾಮಸ್ವಾಮಿ ವಾಸ್ ಎ ಜನರಲ್ ಪ್ರಾಕ್ಟಿಷನರ್.
ಅವ್ರ ಫ್ಯಾಮಿಲಿ ಇಲ್ಲೇ ಇದ್ದಾರೆ.
ಓಹ್ ಹೌದಾ, ನಮಸ್ಕಾರ ನಿಮಗೆ. ಹಾಂ, ಪ್ರಾಬಬ್ಲಿ ಇಫ್ ಹಿ ಹ್ಯಾಸ್ ಬೀನ್ ಸಾರ್ಟ್ ಆಫ್ ರಿಮೆಂಬರ್ಡ್, ದಟ್ಸ್ ಗ್ರೇಟ್. ಓಕೆ, ಅವರಿಂದ ನಾನು ದೊಡ್ಡ ವಿಷಯ ಏನು ಕಲ್ತ್ಕೊಂಡೆ ಅಂತಂತಂದರೆ, ಎಂಥ ಬಡವರಾಗಲಿ ಶ್ರೀಮಂತರಾಗಲಿ ಒಂದೇ ತರಹ ಅವರ ಭಾವನೆ. ಅದಕ್ಕೆ ಹಿಂಗೆ ಅವರು ಕ್ಯೂನಲ್ಲಿ ಬಂದರೆ ಹಾಂ ಮುನ್ನೆ ಪಾಪ ನೆಕ್ಸ್ಟ್ ಅವ್ರು ದುಡ್ಡು ತೊಗೊಳ್ದೇ ಇದ್ದರೆ ನೆಕ್ಸ್ಟ್ ಹೋಗಲಿ ಅಂತಂತಂದ್ಬಿಟ್ಟು ಅಷ್ಟು ಧಾರಾಳ ಮನಸ್ಸಿಂದ ಅವರು ಈ ಕ್ಷೇತ್ರದಲ್ಲಿ ಅನೇಕ ಜನರಿಗೆ ಸೇವೆ ಮಾಡಿದ್ದಾರೆ. ಇದೇ ಕ್ಷೇತ್ರದಿಂದ ಅಲ್ಲ, ಅನೇಕ ಕಡೆಗಳಿಂದ ಬಂದು ಅವರನ್ನು ನೋಡ್ತಾ ಇದ್ದರು. ಬಟ್ he was such an inspiration to say that ಹೆಂಗಿರಬೇಕು ಒಬ್ಬರು ಡಾಕ್ಟ್ರು, ಎಷ್ಟು ಹಸನ್ಮುಖವಾಗಿರಬೇಕು ಮತ್ತು ಎಷ್ಟು ಕಾರುಣ್ಯದಿಂದ ಅವರು ಪೇಷಂಟ್ಸನ್ನು ಟ್ರೀಟ್ ಮಾಡ್ತಾಯಿದ್ರು ಅಂತ ಅನ್ನೋದಕ್ಕೆ he was a very big he was a very big inspiration for me ಅಂತ ಹೇಳ್ಬೋದು. Next thing is Dr. Chandrama Sagar, who has really sort of saved my life on a couple of occasions. It was unrelated to her subject, but still I had such bleeding from my teeth, that is after an extraction. Those days the government dental college was not open at night times, and I had a major tooth extraction or some problems with my dental care, and I started bleeding quite profusely at night, and there was nobody that we could approach. Because she was a family friend, we went to her nursing home, and you wouldn't believe, she put a pack, adrenal pack anta ansutte, and she sat with me through the night. ಅಲ್ಲೇ ಮಲಗಿಸ್ಬಿಟ್ಟು ತಾವು ಅಲ್ಲೇ ಮಲಕ್ಕೊಂಡಿದ್ರು. ಕ್ಯಾನ್ ಯು ಇಮ್ಯಾಜಿನ್ ದ ಸಚ್ ಡೆಡಿಕೇಶನ್ And also she had not restricted herself to obs and gynae. ಎಷ್ಟೋ ಜನ ಎಷ್ಟೊಂದು ಟ್ರೀಟ್ಮೆಂಟ್ಗೆ. ದ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ ವಾಸ್ ಅ ಸರ್ಜಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ ದಟ್ ಐ ಹ್ಯಾಡ್. ಅಪೆಂಡಿಸೆಕ್ಟಮಿ ಮಾಡಬೇಕು ಅಂತ ಯಾರೋ ಹೇಳಿದ್ರು. ಇವಳಿಗೇನೂ ಆಗಿಲ್ಲ, ಸುಮ್ಮನೆರು ಆ್ಯಂಟಿಬಯೋಟಿಕ್ಸಿಂದ ಟ್ರೀಟ್ ಮಾಡೋಣ, ಸ್ವಲ್ಪ ದಿವಸ ನೋಡೋಣ ಅಂತಂತಂದ್ಬಿಟ್ಟು. ಐ ವಾಸ್ ಇನ್ ದ ಪೀಡಿಯಾಟ್ರಿಕ್ ಏಜ್ ಗ್ರೂಪ್. ಬಟ್ ದಟ್ ವಾಸ್ ದಿ ಹಾರ್ಟ್, ದಟ್ ವಾಸ್ ದ ಡೆಡಿಕೇಶನ್, ದಟ್ ವಾಸ್ ದ greatest clinical acumen people had those days, and they wouldn't restrict to their specialty and subspecialty areas, and they were very, very generous in seeing patients ಅಂತಂತ ಹೇಳಬೇಕಾಗತ್ತೆ. ಮತ್ತು ಇನ್ನೊಂದೇನು ಅಂತಂತಂದರೆ ಡಾಕ್ಟರ್ M.T. ಸುಂದರಮ್ಮ, ಐ ಡೋಂಟ್ ನೋ ವೆದರ್ ಪೀಪಲ್ ರಿಮೆಂಬರ್ಡ್ ಹರ್, ಜೂಬ್ಲಿ ನರ್ಸಿಂಗ್ ಹೋಮು. ಮತ್ತು ಅವರು ಅಷ್ಟೇ, ಅವರು ಅವ್ರ ಹಸ್ಬೆಂಡ್ ಡಾಕ್ಟರ್ ವಿಶ್ವೇಶ್ವರಯ್ಯ, ದೇ ಹ್ಯಾವ್ ಡನ್ ಯೋಮನ್ ಸರ್ವಿಸ್ ಫಾರ್ ಪೀಪಲ್. ಅಲ್ಲೂ ಅಷ್ಟೇ, ದುಡ್ಡಿಲ್ಲದೆ ಇದ್ದರೆ ಪರವಾಗಿ ಯಾವಾಗಲೂ ಕೊಟ್ಟರೆ ಆಯಿತು, ಯಾವಾಗಲಾದರೂ ತೊಗೊಂಬಮ್ಮ ಅಂತಂತ ಹೇಳೋರು. ಆ್ಯಂಡ್ ಆಲ್ಸೋ ಕನ್ಸೆಷನ್ಸ್ಗಂತೂ ಲೆಕ್ಕವೇ ಇಲ್ಲ. ಅದು ಅಲ್ಲದೆ ದೇ ಹ್ಯಾಡ್ ನಾಟ್ ರಿಸ್ಟ್ರಿಕ್ಟೆಡ್ ದೆಮ್ಸೆಲ್ಸ್ ಟು ಅಗೇನ್ ದ ಫೀಲ್ಡ್ ಆಫ್ ಆಬ್ಸ್ಟ್ರಿಕ್ಸ್ ಆ್ಯಂಡ್ ಗೈನಕಾಲಜಿ. ಎನಿಥಿಂಗ್ ದಟ್ ಎನಿಬಡಿ ವಾಂಟೆಡ್ ದೇ ವುಡ್ ಡೂ, ದೇ ವುಡ್ ಹೆಲ್ಪ್ ಔಟ್ ಅಂತಂತ ಹೇಳೋದಕ್ಕೆ ತುಂಬ ಸಂತೋಷ ಪಡ್ತೀನಿ. ಮತ್ತು ದೇ ವರ್ ಆಲ್ ಸಚ್ ಬಿಗ್ ಇನ್ಸ್ಪಿರೇಷನ್ಸ್. ಸೊ ಈ ತರಹ ಬಸವನಗುಡಿನಲ್ಲಿ ಅನೇಕ ಡಾಕ್ಟ್ರುಗಳು, ಡಾಕ್ಟರ್ ಕೆ ರಾಮರಾವನ್ ಅವ್ರನ್ನಂತೂ, ಅಂದರೆ ಇವರ ತಾತ ಸಂಜಯ್ ಅವರ ತಾತನ ನಮ್ಮ ಮನೆಯವರೆಲ್ಲ ಅವ್ರನ್ನ ದೇವರು ಅಂತಲೇ ನೋಡ್ತಾಯಿದ್ರು. ಅಷ್ಟೊಂದು ದೋ ಐ ಡೋಂಟ್ I'm not born to doctors. I've been married to a family of doctors, and Dr. R. Nagaratna, who is pioneered in yoga therapy, she was the biggest inspiration for me in my life. And she was also like this. ಅವರೊಂದು ಕಾರ್ನರ್ನಲ್ಲಿ ಹುಂಡಿ ಇಟ್ಟಿರ್ತಾಯಿದ್ರು, ಯಾರು ಬೇಕಾದರೂ ದುಡ್ಡು ಹಾಕಬಹುದು, ಇಲ್ಲದೇ ಇದ್ದರೆ ಹಾಗೆ ಹೋಗಬಹುದು ಅನ್ನೋ ತರಹ. ಅಷ್ಟೊಂದು ವಿಶೇಷವಾಗಿ ಈ ಏರಿಯಾನಲ್ಲಿ ಅನೇಕ ಜನ ಸೇವೆ ಸಲ್ಲಿಸಿದ್ದಾರೆ. ಆ್ಯಂಡ್ ಬಸವನಗುಡಿ ಈಸ್ ವೆರಿ ವೆರಿ ಪ್ರಿವಿಲೇಜ್ ಟು ಹ್ಯಾವ್ ಸಚ್ ಗ್ರೇಟ್ ಇಂಡಿವಿಜುವಲ್ಸ್. ಆ್ಯಂಡ್ ಐ ಆಮ್ ವೆರಿ indebted to all of them for all the inspiration they have instilled in me. Thank you very much for this opportunity. It is, congratulations again for organizing this program, and there are stalwarts whom I again bow down and say you have had great parentage, you are continuing the great work. Thank you.
Thank you, Dr. Lata Venkatram. And I think we'll just wrap up with one last question this lady in the fourth row has been asking. Is Dr. Meera Krishna Prasad around? From Jubilee Nursing Home, I think she's left. We had her also here this evening. Yes, ma'am.
Good evening. I was a teacher in home school. I have got all my students here.
Oh my God. Madam Farida. Farida ma'am was my nursery school teacher too.
Aditya.
And yes, all of us were homeschooled.
And here, Pavani was my student. Dr. Ramswamy's granddaughter. And Madhi. And Anubha, Vaibhav.
Farida ma'am, no?
Abhinav.
We all remember her.
Abhinav. He was my student. And Dr. Ramesh's son, Gaurant, doctor, was my student. So I'm very happy that my students are all doctors doing so well. God bless you all.
Thank you.
Doctors Dawa, Allah Shifa.
Wow. Amazing. What an amazing way to culminate this program, and there's lots and lots of stories to be retold. We hope to continue this legacy documentation for further days, and thank you all for being with us this evening and spending this kind of a time on a weekday evening. It's really very humbling for us, Team Maya and myself, and who have painstakingly helped me put this together. I'd just like to introduce them to all of you. Naveen, my colleague Naveen is there behind the camera. Rukmini is here. She helped me document all the photographs. And Chandru and Aditi have been working relentlessly with me for the last couple of weeks to put all this together, and of course my co-curator Radha Rao, who's also in the audience. Thank you all for being a part of this very, very wonderful evening, and we hope to carry this forward with all your support. Thank you and good evening. Thank you, Mrs. Kamla. Thank you. Mrs. Sudha, thank you.